make life easier for you, here's our guide to the top 5 problems people have when starting CPAP therapy and how you can solve them. I'm going to cover stomach bloating, dry mouth, dry eyes, problems falling asleep, and general discomfort. Now, most of these issues can be fixed with some setting and equipment tweaks or by adopting some simple best practices. So don't let them get in between you and that glorious realm of sweet dreams. It can be hard at the beginning, but trust us, it's worth it. So let's start with problem number 1, stomach bloating. The proper name for stomach bloating is aerophagia, and it happens when you swallow air into your stomach. If this air builds up too much, it can be very uncomfortable, and at some point, that air will have to escape and, well, I'll spare you the details. There can be a few causes of this, so fixing it might take a bit of experimentation. It might be that your pressure settings are too high or even too low. If they're too high, the extra pressure might overwhelm your lungs' capacity to intake the air, and the excess air forces itself into your stomach instead. But if it's too low, you may have more gasping apnea events, which means you suck air into your stomach that way. The solution here is to get your therapy pressure settings just right. This should be done in consultation with a physician, but a general principle is to keep your apnea events under control at the lowest pressure possible. If your apnea-hypopnea index, or AHI, which measures your apnea events and appears in your sleep data, is 5 or less, it should be fine to reduce the pressure settings just a little. But especially for beginners, talk to your doctor about that before adjusting any of these settings yourself. Separately to this, you can also use pressure relief settings on your exhale if your machine allows it. Now, this feature goes by various names depending on your CPAP brand, like EPR or Easy Breathe. But by whatever name it goes by on your machine, it will drop the pressure when the therapy algorithm detects that you're breathing out. The level of drop will depend on the setting that you put for this, so it can be tweaked to make sure that you're able to sufficiently empty your lungs and then have the capacity to breathe air back into them without swallowing it. So increase the relief setting if you find exhaling difficult. Mouth breathing can also be a cause of stomach bloating, but I'll deal with that in the next one when I talk about problem number 2, dry mouth.